What's the difference between a drug or a treatment being contraindicated versus it being not indicated for a particular disorder? Contraindicated means that it should not be used. Not indicated means that's not exactly what it's meant for. And there's a difference there. So, and under contraindications, there's absolute contraindications and there's relative contraindications. Absolute contraindications means hard stop. No, there's under no circumstances should it be used. For example, Accutane, which is a medication used for acne, should not be used ever in a pregnant woman. The risks to the fetus far outweigh any benefits as far as the acne is concerned. It can cause congenital malformations in the child. So Accutane is absolutely contraindicated in pregnancy. Actually, if you look at the wrapping on the packaging, they have little pregnant women with an X going through them because you cannot take it if you're pregnant. So relative contraindication means that there is a risk to using the drug or the treatment, but the benefits may sometimes outweigh those risks. So, for example, let's say you're taking a medication and you need a second medication for another disorder, and there's an interaction between the two, but the risk of not treating the second disorder is worse than treating it. And so, there might be some interaction, but the benefits outweigh the risk. So that's relative contraindication. Now, a drug can be not indicated for a particular disorder, but that doesn't mean you can't use it in those people. So, for example, medications like Farxiga or Jardiance, the SGLT2 inhibitors, are not meant for the treatment of type 1 diabetes. So, however, if someone with type 1 diabetes also has congestive heart failure, then you can use it for the heart failure. You're not using it for the type 1 diabetes. So when drug companies come up with a new medication and they want it approved by the FDA, they have to say this is what it should be used for, and have to present the data to say that this is what the drug is used for. And then they get what's called the indication. So whatever the official purpose is for the use of that drug, that is the indication. That doesn't mean that you can't use that drug for other things. It does make it hard to get approved by insurance, but that's just not its official use. So, for example, another example is metformin. It is indicated for the use of type 2 diabetes. But we use it in people with PCOS because it helps with their insulin resistance. It's not indicated for PCOS. There's nothing that's indicated for PCOS. But we use it for that because there's science behind it. It's just not the FDA approved reason. So that's the difference between absolute contraindication, relative contraindication, and not indicated for.